to Let's Talk About Mental Health. I'm the co-host, Nels Kloster. I'm a psychiatrist in southern Vermont.
And I'm Robert Stack. I'm a drug and alcohol counselor.
Yeah.
Welcome to this evening's show. I guess I wanted to say just a little bit about last week. I talked about marijuana, and I think I was a bit on my soapbox, and that's really not the intention of this show. The show was to be helpful and sort of talk about addiction and dependency and mental illness, and so, but it just sort of, I got these opinions, and I just sort of went with it.
It's funny, but it's an emotional issue, isn't it?
Yeah, I guess.
It gets very divided, and people are for and people are against, and I'm kind of reminded of those old Saturday Night Live debates between Dan Aykroyd and Jay Curtin. It just always broke down into personal attacks. So.
Yeah. Well, I thought you were very patient with me when I went off on my rants about it. But anyway, if you don't mind, we'll do this first question, and you know, this is obviously somebody who watched this show. They say, how come people taking Valium, Xanax, Ativan, Thorazine, Seroquel, Suboxone, and methadone can drive cars? Don't those medications cause as many accidents as pot and alcohol? Well, I don't know. I mean, if they're impaired, what I was talking about was a level of impairment. If it interferes with your ability to drive safely, then you shouldn't drive. You should. Sometimes when I work with alcoholics, sometimes after they get their second or third DWI, they have a choice. They can quit drinking or they can quit driving. And most alcoholics will quit driving.
Yeah.
You know, well, no, because they're afraid they'll get in the car and they'll get another ticket. I mean, it's really dangerous. So I don't really want to get into this argument about what drug is better or worse than another. If you're under the influences and it's causing an accident, then you know you shouldn't be driving a car.
Yeah. And I think too, I mean, that's the bottom line here. So it sort of gets away from the question of are we calling, like, say, marijuana medication or not, but really driving and driving impaired is a whole different issue. I mean, I don't want to think that I'm unsafe on the road, regardless of whether it's because of your Seroquel, your Xanax, or Thorazine, or what it might be. With you know, with any medication, I mean, methadone in particular, but as well as the other ones that were mentioned, you're looking for a range that's therapeutic. And of course, not a high enough dose, then you're not getting the benefit of that medication. But then if it's too high a dose also, then more of the side effects, more of the unwanted effects. And amongst those can be sedation or decreased concentration, for example, with like, you know, Valium, Xanax, Ativan, with coordination, Thorazine, Seroquel with alertness. So absolutely right. I mean, maybe even to the point of recommending when you're getting started on one of these medications, you shouldn't be driving. We do that with methadone. Don't drive to your first appointments. You need to make sure that you have a clear head before you start driving with these.
Right. There was a column in the paper about the substance abuse, and again, the idea that I was trying to say was that marijuana is not a benign substance. I mean, it affects the way you think, it affects your perceptions, it affects and it has long-term effects. Some of them are subtle, but you know. And anyway, so that was really the point I was trying to make, was that people are approaching this decriminalization almost as if by some accident it was against the law. I mean, it was no accident. I mean, it was. You know, it was lumped together with some other drugs at a time, but nonetheless, it is a drug, and people should be mindful of that. Okay, that's enough.
Yeah, again, even if we, our side is not winning the debate about depenalization of marijuana or marijuana as a medication, there's still an issue with every medication. That when I'm prescribing, I'm very careful about there are positive and negative effects from these medications, and we need to be aware that there's an equation there, and we're hoping to have the benefit outweigh the risk.
Okay.
All right. So this one comes from, let's say, communication with a text or an email that came in this week. It says, hello, I'll just dive right in here. I realize that self-mutilation or cutting has reached a new all-time high in the adolescent population, and especially with adolescent girls. What is your advice to a single foster mother, no other kids in the house or a paramour, who is dealing with an adolescent who is cutting? She's already receiving therapy and is on a mood stabilizer, both of which seem to be beneficial to her. Thank you so much. Wow. Yeah, you know, I don't know personally about the sort of statistics around this, but I do get that sense from sort of talking to people, whether it's awareness or not, that this really does seem to be happening more commonly, and whether it's a fad or not. It's certainly being taken seriously. My understanding is that the next edition of the diagnostic manual is looking to separate out cutting as its own disorder, as opposed to it being one symptom of a borderline personality disorder. So definitely, I mean, and two, I think, one thing I often like to say that, this is not suicidal behavior. While it's dangerous, someone being a cutting is not the same thing as someone who's, say, cutting their wrists with the intent to die, but it's certainly distressing and dangerous behavior.
Yeah, and I think, one of the things that sort of struck me in this question is that she's a foster mom, and so she has a foster child, and we really don't know what else has gone on in this child's life, and what preceded the event that she became into the care of a foster family. I remember at one point in my internship working with Dr. Susan Abraham, and one of the things I sort of came away with was understanding that a lot of times cutting had something to do with not only does the cutter say it makes them feel better, like the healing process somehow releases these enzymes and everything, but even more important, it's an indication of how much pain they're in, what's going on inside. And I think a lot of us, and I say a lot of us, and I mean, I've had this, there's a inarticulateness about feelings and emotions. Van Morrison had a song about that. No, or an album. I mean, no, really, you get to a point where words just don't work. You just don't know how to express how much pain you are in or how you're feeling. And I think in some cases, cutting becomes a symbolic act. And not just symbolic, but in some ways it helps people sort of feel like they're getting something out. I don't know. I don't understand the whole thing, but
and it's a little hard to understand intuitively, isn't it? When you think
right.
about how much it hurts, the times that I've by mistake cut myself, and while statistics don't tell all, there has been an association with cutting and certain personality styles and trauma, and like you said, coming into foster care, I'm not sure if we know much about if you know much about her family, or what the circumstances were that brought her into foster right. care, but quite often we see that both sort of nature and nurture, sort of a genetic and an environmental influence that can play a role in really everything in psychiatry. And often we'll see that trauma being something that seems to be very common right. with people who cut themselves. And the
good news is that over the years, and maybe this is just a very small experience, but I have known many people who have just decided to stop. Mm-hmm. And they get to a certain age or they get to a certain point and they don't do it anymore. Yeah, yeah. And maybe it'd be working with a therapist or working with a doctor or just finding another way to express their feelings and emotions. I don't know what it is, but I think, like you said, it's really scary. It's really scary to see it, self-inflicted harm. It's really, to me it is anyway, very anxiety-producing for me. But I think it's just an attempt on some level to express something about how someone is feeling right. and somehow doing something about it. So yeah. I think once they learn alternative methods or they find out that this isn't necessary or there's another way to do this, and there's such a good sign that she is in therapy and she has somebody in her life who cares about her. And
yeah.
I hope that works out okay.
And actually seems to be doing better. A lot of the women that I've talked to who have struggled with cutting will tell you that there's just great emotional discomfort, and the cutting makes them feel sort of more grounded, more real, more in touch. Yeah. But like you were saying, gives a sense of relief. Yeah. And I'm not sure, and I definitely want to watch that, not to criticize any kind of treatments going on right now, but there's this specific type of treatment called dialectical behavioral therapy, which is an offshoot of cognitive behavioral therapy that we've talked so much about in the past, and also applies sort of Eastern philosophical thought, and holds both, not just the idea that you need to change, but also there needs to be some acceptance as well, and focuses on areas of how do you get along with other people, called interpersonal effectiveness, better ways to tolerate distress, to be mindful, and to be able to work with what's called a wise mind instead of emotional mind. And that seems to be, well, it's really, I think it's safe to say there are other things coming on, but it's one of the more established specific types of treatment that we have that deal with cutting.
Right. And also, I just wonder if maybe the foster mom is getting enough support. I imagine being a foster mother is really, you know, a very difficult job.
Right. And it sounds like a single parent in this case.
Single parent. And I wonder if she could either be involved in adolescence therapy, perhaps, maybe have some meetings together to talk about what it feels like for her to experience this. Sometimes, and I know, you know, one of the things that's hard for sometimes people who struggle with addiction and mental illness is that they tend to be so self-centered on their own illness and pain. I mean, quite frankly, the illness almost consumes you. It becomes almost like a self-definition, if you will. Right. And I think sometimes to figure out what it's done to other people or begin to recognize what's happening to other people is to begin to concern about the other. And I think that's really important. So I'm glad this person emailed this in, I think, or text. I hope she goes and get help, and I hope this is helpful to her. Yeah. Is that all right?
Absolutely, yeah.
Okay.
No, I think so. This is, it's very dramatic behavior.
Right. Yeah.
So do you consider gambling, overeating, computer games, and pornography to be addictions? If so, are 12-step programs really helpful in dealing with them? I've never seen a group for being powerless to stop playing computer games. Is there one? Well, you're our 12-step expert.
Yeah, I don't know about that. Well, I don't know. I guess you could go to Silicon Valley in California and find out if there's people there who have said that you know, being on a computer has taken over their life and it's affected their loved ones, and they're at a point now where it's causing harm to themselves. And they feel that they can't stop using, and it's cost them a job. They've tried to stop, and they've been unable to stop. It's interfered with their health. And at that point, I would hope they do talk to someone. You know, I know it's sort of 12-step programs. I mean, people love to make fun of them, unless you know someone who's had their life saved by it. This is a good time for me just to say, early in my career, working at the retreat, I had the privilege of escorting patients to AA meetings. They have open meetings.
Right, to expose them to that.
Right, and exposed me to it. And in the first 2 or 3 years before I got into apprentice counselor program, I learned a lot by sitting in these open meetings and listening to people talk about their recovery, and it's incredibly uplifting. So I don't, you know, when people sort of say, you know, I find a little bit snide about, you know, what if I'm powerless to stop playing a computer game. Well, it sounds funny to you right up till it happens to you.
Until it happens to you, or somebody that you care about.
And someone that you care about. And if you want to back up, gambling is a whole nother issue. My good friend Joy Mitchell runs a gambling program in Vermont and New Hampshire. There are people who get in big trouble with gambling, and that is a whole, I mean, believe me, that destroys families and everybody's lives, and it's nothing to be taken lightly, and Gamblers Anonymous is helpful. There's not that many meetings, but the ones that are, I mean, that people get to, they do well. So overeating, there's Overeaters Anonymous. There's different approaches to overeating. There's binge eating, there's, you know, bulimia, there's, you know, different people get different kinds of help, but for some people, Overeaters Anonymous is a very successful program. So you know, I
Afraid of being defensive here?
Yeah, well, no, that's all right. I mean, it's like, I think 12-step programs are helpful with people. Yeah. And I think, you know, and they're spiritual programs, and they work with other people, and they get help from other people. You're not in this alone. So, I mean, you know, I'll stop there.
And one of the things, too, that these problems that have been mentioned, the gambling, overeating, computer games, pornography addiction, they're, you know, it's a newer idea to us. They hold a lot of the same characteristics as other addictions do. There's this compulsion, you lose control, interferes with your relationships and your daily activities. And so they've been lumped under the category of process disorders, or process addictions, right? We're not necessarily addicted to a substance. It's not like with the opioids or with the alcohol. But what is happening is that there's this process, this thing you do that has characteristics in common with that. And I mean, 12-step meetings, I'll say something in support of them as well. There's, especially with addiction, you know, one of the problems that people struggle with is their social circle is focused on using that drug. It encourages drinking, it encourages drug use, and when you go to a 12-step meeting, whether it's AA or NA for Narcotics Anonymous, or even I'm going to put in a plug for Weight Watchers, because when I've heard people talk about Weight Watchers, it sounds like a 12-step meeting to me, except there is somebody who's really kind of in control and running the show. And you get surrounded by people who encourage you to not do this thing you want to stop doing. And there's a power to that in itself, to have a community that is encouraging you towards more healthy behavior and abandoning this unhealthy behavior. But at the same time, it actually seems to be, through the research, an ability to say no, a resistance that comes with that. Now, not that we're encouraging people who are overweight to go, you know, hang out in the bakery, or for alcoholics to sit in the package store and tempt themselves. But there do come up these opportunities where you're caught by surprise. And having been involved in the 12-step program seems to help us to then say no and take it away from that situation.
Yeah, and it's proven that people can become abstinent and they have better lives. And I think my overreaction is all my years as a counselor, if I say that to somebody, like go to AA or NA or something, they would like, oh, I don't like it. And it's sort of, I guess it used to bug me a little bit. I mean, and I would say to myself, but sometimes to the patient, if I trusted our relationship, that it would be like saying to a diabetic, you know, well, I want you to prick your finger so many times a day, and I want you to, you know, and they said, oh, I don't want to do that. You go, well, gee, you know, this is what you need to do. I mean, it's so here's something that we're suggesting. It's helpful, it's beneficial. It isn't about whether or not you like it, per se. You know what I mean? It's like, well, who likes getting up and going, you know, doing all the things you need to do? The question is, do you want to get better? Right. If you want to get better, if you want to stop, well, then you need to do this.
Yeah, and find a way that helps you get better. If you haven't tried it, maybe you should bear in and give that a go.
Right.
And see if it wouldn't help you.
Right, and I struggle with my, I just finished with this, I don't want to use up all the time, but, you know, I struggle with my blood pressure, and for years I have high blood pressure. And the first time the doctor talked to me about it, he said something about losing weight and exercise, no salt. And the next time I went back to see him, you know, I had gained weight.
He said, yeah, how did you do with all that
exercise?
That's right.
And so he put me on medications.
Right.
So it was like, you know, and we have a lot of clients like that. You know, we say, well, here's some things you could do. You know, I mean, it takes effort, it takes time, and, you know, you got to go do them. And you come back and you find out, well, they didn't do them. And you go, you know, and they say, well, can you give me a pill? I mean, that's what I do with my blood pressure, but not anymore, because I ran into some other problems, heart problems and stuff. You know, now I'm on the treadmill every day.
So you took it seriously.
Yeah. Well, once they, you know, they sort of say, well, you know, COPD and everything, you know, you think, well, okay, I'll cut it out. But I'm just saying, I mean, you know, a lot of times people sort of see 12-step programs, I guess they're sort of, you know, for people who need them, for people who want recovery, they work really well. I mean, and if you don't want them, I mean, obviously, you know, you don't go, they don't get better, that's fine. But they're high on my list of when I'm dealing with an alcoholic or an addict. I think it's, you know, if you can do this and, you know, give it a shot, I don't think we'll need to talk much more.
Yeah. And to bring up, since you brought it up, there's a spectrum of treatment here. And the idea is that sort of the way we look at most disorders that could have medication applied to them is that maybe sort of behavioral change is the first step. So rather than giving a pill that, again, like we were talking about the earlier question about the impairment with driving, that has, you know, positive and negative side effects, maybe if you could get on a treadmill and lose some weight, you wouldn't need this medication. And same thing with people in AA and the 12-step programs. Try first to make these changes. Get with a supportive group of people and see what kind of impact that has. And then maybe the next step would be some kind of medication, and then progressively stronger ones. With these process addictions, though, the gambling and pornography and gaming on the computer, that medications don't have such a clear-cut benefit for those. They don't seem to be quite as effective for helping to decrease that gambling and the other process addiction. So, but then until you get to a point where pull out all the stops and try whatever it takes.
To everybody else who sort of has sort of passing interest in addiction or psychiatry or whatever, they find it interesting from some point of view, that's okay. But for someone who's actively affected by these two illnesses, addiction and mental illness, it can be so overwhelming and so painful.
Yeah, and I think too, that's often when physicians really gain some empathy, is when they struggle with their own illness. So I think when you get first-hand contact, like Jody Williams says, she mentioned her brother, or just with her own illnesses as well, that all of a sudden, oh my God, it gets you to a whole other level as far as your empathy, your capacity for your compassion when you're dealing with patients. So, of course, those who are fortunate not to have had that kind of struggle, good for you.
Okay.
So I think we overcome our technical difficulties here. So thank God for iPads and technology. So my boyfriend lost his job last year and has not been the same since. He hasn't gotten another job, though I think he tried for a few months. Now he just sleeps late and lies around all day. We used to run together and he stopped doing that, saying he just can't get the energy for it. We never go out anymore, so I've taken to going out with friends without him. I've tried to get him to talk to a doctor, but he says without insurance he can't afford it. His savings are gone and I feel like he's not doing anything to help himself. And I'm almost ready to break up with him, except I feel like he would try and kill himself if I wasn't around. Help, with an exclamation point. Yeah, I'd imagine there's a lot of people struggling with exactly this scenario with the way the economy's been these days. Well, this guy sounds severely depressed.
Right, and we had talked about it next week, doing a show just on depression, talking a little bit about maybe depression and alcoholism, depression and opiate addiction, drug addiction. But again, a lot of those symptoms, and that last sentence, I'm afraid that he's going to kill himself. And I think a lot of family members will get to that point where they feel like, I don't feel like I can go on this way. I don't feel like I can do this. I feel like, people will encourage someone to leave, well, leave them, you need to take, and then in the back of your mind, you say, well, if I leave him, what will happen to him?
Right.
And I do love him.
It's hard. Am I enabling this to continue? Am I saving him from the brink?
Yeah.
It's really hard.
And you hear that with alcoholism and drug addiction too. I mean, you'll hear people, say, well, why don't you just leave them? Or, and you love somebody and you say, well, I don't want to leave them. I don't want to desert them. I'm afraid what will happen. I mean, and I think with people with, and again, that sounds like a fairly classic case of depression. I mean, it's really difficult. I go ahead. What would you suggest?
Well, I just want to say, we don't know what he was like before he lost his job, and it sounds like that was really a very pivotal event.
Right.
That he's not been the same since having lost his job. And we also come up with this whole sort of, nature versus nurture thing, right? I mean, some of us are more vulnerable to depression, some of us are more resilient against depression. But, one of the ideas behind this is if enough bad things happen to you, you're going to wind up being depressed. You have to react to that. You have to pull away. And, for guys, I mean, as limiting or narrow as it sounds like, our work really is very important to us.
Right.
There's this social role. We're supposed to, we're expected to go to work than we are to stay home and take care of the kids. Although that's all, that's all satisfying work to do. But I'd imagine that here he is with this and seeing that he's not finding any new work, and all the classic symptoms of depression here. Probably not sleeping or sleeping too much. Not motivated to do anything, whether that's the source for him not running or not, no energy as well. And when this progresses, the worst thing we think about is then there is this, the thoughts of death, thoughts of suicide. And I think you've often described it to me as tunnel vision. You get to a point where you're like, what? Nothing else is as promising an option as suicide ending all this.
Right.
So that's really when it gets to a point when I think everybody would, want to reach out to help. The hospital would be open in that case. And it's a shame, though, to think that a lack of insurance is hindering someone from getting the care.
I guess that's a little worrisome. I'm not quite sure how that works. I know when I had, at one point in my life, I didn't have insurance, and I went to HCRS, and they just took me in. I mean, they had a sliding scale, and I think I paid nothing.
That's our community mental health center.
Yeah, and I don't know if that still exists, but that's what I did, and that was helpful to me. And the other thing is that, I don't know if she thinks he would kill himself. I don't know if he's actually said he would. And I think you have to almost be careful about that. I mean, I would call for help if at some point you really thought he was going to harm himself.
I mean, absolutely. I mean, that's the point. If you're truly concerned about that, you have to stop thinking about, well, what if I'm wrong? What are people going to think? I mean, in my professional life, that's the point. I'm like, you know what? If I'm going to make a mistake, I'm going to make a mistake in being too aggressive about this, because that way I feel better about myself, and hopefully something good comes of it. And I just would always want to sort of act more strongly than I had to in a case like that. So besides, calling, the emergency room, that's a classic place to get started with care. What are called screeners or mental health professionals from the community mental health center. It can be found in any emergency room around the state. So by all means, if it gets to the point where you feel like it's really an emergency, get there.
And there is a suicide prevention number. I've seen it.
Right, there's a hotline.
Posted 1-800. I mean, there's different numbers you can call. And as somebody who recently, lost your job, I know how you could feel like,
we can both identify with that.
Yeah, a little bit, I understand that. So I tell you what, next week, like I said, I think we've been trying to do these topics. And so next week we're going to spend some time talking about depression and maybe go over the symptoms. There was a very good article in the Brattleboro Comments about somebody, I think he was in West Chesterfield, who wrote a book about his experience. But if anybody has any questions or any comments they would like to make about depression or anything they'd like to share with us, I think we'll be doing that next week. So I want to thank everybody for the people who sent in your questions, and for those viewers and people who have watched the show. Thank you very much, and I really do mean this. I hope it's helpful in some way.
Yeah, and we'll look forward to seeing you next week and talking more in depth about depression. So please send your questions.
Thank you.